Hello, Gold participants and listeners from around the world. Welcome to Gold Learning. I'm Kristin Schwarz, licensed midwife and MC here at Gold Learning. And here at Gold, we are in the middle of preparing and recording for a brand new lecture pack here. And the lecture pack is titled Complex Medical Issues in the Lactating Parent Lecture Pack. And we can all imagine that medical issues in the lactating parent can often create difficulties with breast and chest feeding and pose a challenge for the lactation professional. So this lecture pack is here to help you with some of the challenges. And before we release the lecture pack, what we like to do here at Gold is we like to meet with some of our speakers so you get to know them a little bit. We'll talk about their work, talk about their background, and then, of course, about the presentation they have in this lecture pack. And with me today is Dr. Fedro Peccatori. Welcome, Dr. Peccatori.
Thank you. Good morning, good afternoon to everybody.
Thank you. It is absolutely wonderful to have you here. And we are so thankful for your time because you are in Italy, and we know how hard this country has been hit now in the COVID-19 crisis, and you're an oncologist. So tell us a little bit about your work over there.
Yes, I am indeed a medical oncologist working in a comprehensive cancer center here in Milano, Italy. And as you said, we have been quite hardly struck by the COVID epidemic and pandemic, I would say. But nonetheless, my research and my clinical activity continues. Of course, I think that science is really the solution also of this very difficult moments, and it's also education. I think it's very important. So the idea of reaching such a large number of people just staying here in my office at my house, it's amazing. So I'm really grateful and happy that this can happen.
Thank you so much. Yeah, go on.
No, and I was saying that I've always been interested in women's health, and from the very beginning, not only by the oncological point of view, I also hold a specialty in obstetrics and gynecology, and so the idea of combining the oncological, let's say, aspects of women health and also the reproductive aspects has always been my keen interests.
Very good. Well, thank you for sharing that, and thank you for doing all this wonderful work out there in the field. Let me ask you this, and research continues. Your work, you're absolutely right. Education and research is so vital, and to fight this, and also, of course, other diseases. And so, for your oncology patients, of course, you must be very concerned about. They are very vulnerable if in the situation with this virus. Correct?
Yes, it's really a complex situation because on one side you have cancer, and on the other side you have all the issues that might be related to this new infection, and we actually do not know exactly what will be the impact of this specific infection on the oncology care or on the oncological patients. We know for sure that some patients are more vulnerable than others. So the patients that are on treatment are more vulnerable for sure. And possibly the patients that have had a cancer diagnosis many years ago, and we will talk about those patients just in a few minutes. While those patients have probably much lower risk compared to the patients that are really on treatment. So it's it's also a lot of reassuring and just doing the right triage for every patient so that we can offer the best treatment also to patients that need the treatment.
Absolutely. Are you planning to publish a research study on the subject in the future?
Well, I think that as we started saying that research and education are really the pillars, I think, of good clinical practice. And I really hope that we will learn something from this pandemic. We are learning day by day. And if if it is possible, I will really continue to, as I said, to do my job and my work. As a matter of fact, my let's say breastfeeding research came really from the oncological world. I realized that breastfeeding was important for women that had a previous diagnosis of cancer. And as breast cancer is the most frequent cancer in young women, there was this added issue of having also the organ that produces the milk that was affected. So it's and
Yeah.
apart from the technical aspects, you will see there are a lot of psychological aspects related to the fact that a previous diagnosis of breast cancer may change the way women related to their own breasts. And of course, if you have a diagnosis of cancer during breastfeeding, which is the other big part of my presentation, it's even worse because you have immediately to change gear and going from breastfeeding to cancer treatment, and
Hmm.
that's very, very difficult for women.
Yeah.
So we are continuing our research on these issues that I think are very important for women and for cancer survivors.
Absolutely. You made a very good and very important point early on. You said breast cancer is, a big issue for young or women, right? Younger women. And I have to tell you, for me, that was kind of a very interesting thing I learned not that long ago. I'm a midwife, but I'm also doing thermography breast screenings as an adjunct, not as a standalone screening measure, of course, right? So, but I've seen through that, I've met a lot of younger women with cancer. So all the assumptions we had originally, all screen women over 40 here in the United States, is we recommend mammograms for women over 40, and so on. But there are so many younger women impacted by breast cancer, right?
Yeah, that's unfortunately true. It's we don't know exactly if the rate of breast cancer in young women
Hmm.
is really increasing.
Hmm.
Probably yes,
Hmm.
probably yes. Some of the data that we have on this specific issue tell us that every decade there is a higher percentage of breast cancer diagnosed in women below the age of 40, which is the conventional age that
Yeah.
define young women from let's say less young women. Not that
Hmm.
someone at 42 is old, of course
Right.
she's not, but that's just a convention due to the a conventional threshold due to the fact that below 40 years of age you have different issues in terms of reproductive issue, in terms of
Hmm.
working life, in terms of children, in terms of how to manage being young and having
Hmm.
cancer. So it's
Yeah.
and so that's, yeah, it's probably true that we have an increased rate of breast cancer in young women. Of course, there is a large unmet need, which is the early diagnosis, because as you were saying, mammographic screening below the age of 40 is really very little effective.
Hmm.
And we still don't have an effective mean of screening young women for breast cancer. Fortunately, even if it is frequent, is not as frequent as in older women. So
Hmm.
breast cancer is the most frequent disease of oncological disease of young women,
Hmm.
but remains quite rare. It's
Hmm.
just around 7% of all breast cancer that occur below the age of 40.
Right. Thank you for clarifying that, and thank you also for presenting on this topic. I have to tell you, I got quite a few questions, in my work from women who ask me about breastfeeding afterwards, or when they have a diagnosis, or even fertility. And I have to, of course, be very honest with them, saying I'm not an oncologist, I'm not a doctor, and I refer them, of course, to their healthcare provider and they're professional. But I feel like it is important for us to be educated on the topic so we can provide good resources to our clients, lead them in the right direction, because with a cancer diagnosis often comes, obviously so many emotions, panic, fear, and then of course we have social media where everybody is an expert, right? And that can be very dangerous too. It's a wonderful means of, connecting and getting information, but one has to be very careful. So I'm so grateful that you will be presenting for us here and giving us evidence-based research and information so we can help our clients better too.
Yeah, you will see in the presentation that some evidences are there, some are not there yet. So we should continue also to, gathering those evidences so that we can really offer the best evidence-based information to our patients. There is a strong need for information from this group of women, and I think my interpretation is because the information that are given are so incoherent according to the different people who are given those information. So we are really trying to have the information about the breastfeeding after breast cancer, which is probably the most frequent question that comes from the public, is within the guidelines, so the oncological guidelines, so that the oncologists know what they are talking about when their patients ask about these specific issues. And also to have the same for the breastfeeding guidelines, because it's the same. I mean, there are two different words, oncology, breastfeeding word, and that sometimes meet, and when they meet, they should speak the same language.
Very good. Well, thank you so much. Before I let you go, Dr. Peccatori, can you give us a little nugget of wisdom here? What are you hoping our listeners will take away from the presentation?
Well, exactly what I was just saying. So to give your clients, your patients, the mothers in general, some clear-cut messages. Sometimes these messages can be very reassuring, as for example, for the possibility and the safety of breastfeeding after breast cancer. Sometimes they can be cautious, like the diagnosis of breast cancer during the breastfeeding. And on that regard, probably we need more awareness in terms of knowledge that a nodule also during breastfeeding can be a breast cancer, so that women and the midwives and IBCLCs should know the difference between the benign disease of the breast during breastfeeding and the malignant disease of the breast during breastfeeding.
Very good. Well, thank you so much for sitting down here with me, answering my questions and
It's a pleasure.
introducing us to the presentation. Thank you so much. And our thoughts are with you, your family, and your team. And thank you so much. And please stay safe.
Thank you.
And for our listeners, the presentation Breast Cancer During Breastfeeding and Breastfeeding After Breast Cancer is part of the Complex Medical Issues in the Lactating Parent Lecture Pack. This lecture pack will be available starting March 30th. That's just around the corner. And we would like to invite you to look at all the presentations in the lecture pack, find out more about them. And you can do so on our website at goldlearning.com. Thank you, everyone, for listening here. And bye-bye, everyone.